We're going to cross live now to SABC News anchor and reporter Chriselda Lewis, my colleague, who is waiting for that arrival at the moment in Waterkloof. Do bear with us. There is a little bit of a delay, but just crossing to Chriselda. A very good evening to you, Chris. Opportune time, of course, at this time for the Cuban doctors to be arriving in South Africa. As I've just read, that the numbers have gone up, and of course the numbers in South Africa are continuing to rise.
Well, indeed, Flo, quite an opportune time to have the arrival of more than 200 Cuban healthcare workers arriving in the country in just a few hours from now to assist this country in the fight against the coronavirus. And as you've indicated, the total number of confirmed cases is standing at 4,546 and the death toll at 87. While to date over 168,000 tests have been conducted, any help to bolster the fight against COVID-19 in the country is welcome. So with the arrival of the Cuban healthcare professionals, about 45 minutes ago, the Health Minister, Dr. Zweli Mkhize, said he was welcoming the medical brigade to the country after the Republic of South Africa had, of course, requested the government of Cuba for assistance and medical personnel support comprising of infectious diseases specialists to support South Africa in its efforts to deal with COVID-19. He also, of course, made reference to South Africa's strong social and political solidarity and support that exists between the two countries in terms of various development programs, without forgetting, of course, the support that Cuba offered South Africa during difficult times of apartheid. And now, once again, Cuba is lending a hand. So Cuba, of course, is known for its, disaster preparedness and its consistent deployment of medical brigades for disaster relief wherever required, with a continuous learning from Havana and its goodwill worldwide. Some of these are highly skilled health professionals were in the front line, you'd recall, Flo, of fighting other outbreaks in the world, such as cholera in Haiti in 2010 and Ebola in West Africa in 2013. So quite crucially, before the departure from Cuba, that medical brigade that's on its way to South Africa had been placed in quarantine to ensure that they minimize any form of exposure prior to coming to South Africa. And this despite the fact that Cuba is one of the countries where the reported COVID-19 infection rate does remain minimal. So as South Africa, I know that the country is also taking additional steps, which is in line with our lockdown regulations here in the country. The team will also be put in precautionary quarantine as they await their results. So once that process is concluded, the President of the Republic of South Africa, Cyril Ramaphosa, together with other ministers, will formally welcome that team to the country before they are then deployed to the various areas where that kind of help is needed.
Do we have any idea, and just on that point, do we have any idea how they will they be grouped? Will these doctors be grouped? I mean, you're looking at Gauteng province, which of course remains the highest in terms of COVID-19 infections at 1,331, then followed by the Western Cape, 1,608, and then moving on to KZN, which is 863 cases. Is there an assumption at this point that these doctors will then be stationed at those top three provinces that are most affected by the virus, or is there not yet clarity in that regard?
Well, Flo, not at this stage, but one would really presume that all the assistance that South Africa is getting from Cuba, those healthcare workers or the medical brigade will be stationed in areas where it is most needed. So obviously the health department, together with all of the other stakeholders involved in garnering this kind of assistance from Cuba, will certainly need to look at where this medical brigade is certainly needed. Where does South Africa need to bolster its efforts in terms of medical personnel to be able to fight the further spread of the coronavirus in the country? No particular direction at this stage in terms of where exactly this team will be deployed to, but one would certainly presume right now, Flo, that it will certainly be deployed, or this team will be deployed to areas that will really need to bolster efforts in terms of staff or medical personnel to fight the spread of COVID-19 in the country.
All right, Chriselda, let's leave it there. Thank you very much. And no doubt we'll be catching up with you later as, of course, that team is set to arrive shortly there at Waterkloof. Thank you very much. That's senior reporter Chriselda Lewis, of course, coming to us from Waterkloof in Pretoria, where we are expecting to receive the Cuban doctors.